Hello, my name is Brendan O'Connell. I'm a grassroots member of the West Roxbury-Rosendale chapter of Massachusetts Citizens for Life, which was started over 30 years ago by fellow Bostonians Claire Donahoe and Margaret O'Hara. Our chapter believes this television show, named Life Matters, is vitally important for all Bostonians, whether they're residents, folks working in Boston, teenagers, college students, politicians, or whomever. Today's television pro examines why married couples have difficulty getting pregnant and what they can do about it. For instance, are they just too old to conceive a child? Is it just a non-curable medical problem with one or both of the partners? Is in vitro fertilization the only possible answer, although the cost, success rate, and tangential problems of this method are still rather discouraging? And what about the moral and ethical issues of the couple? Are the values being compromised by in vitro fertilization? Today's guest will address these questions. I think you'll find today's show to be unique, informative, content-rich, truthful, and thought-provoking. Today's guest is a magna cum laude graduate of Assumption College, I believe 1982, and a 1986 graduate of St. Louis University School of Medicine with honors in both ethics and high-risk obstetrics. Our guest is a board-certified in family practice medicine and recently chaired the family practice department at Hayward Hospital in Gardner, Massachusetts. His medical practice goes by the name In His Image Family Medicine, PC, which features obstetrics and something called Nei Pro Technology. Among his many accomplishments and affiliations, he's a graduate and now part-time faculty member of the Natural Family Planning Medical Consultant Program of the Pope Paul VI Institute for the Study of Human Reproduction in Omaha, Nebraska. He is also certified by the American Academy of Fertility Care Professionals and is a member of their ethics committee. He and his wife, Suzanne, are the proud parents of 4 boys. Welcome to our guest, Dr. Paul Carpentier.
Great to be here, Brendan. Thanks for having me.
Nice to have you, Dr. Carpentier. Before we get started, I would just like to mention the call-in phone number should you, our viewing audience, have any questions for our guest regarding conceiving a child. The number is 617-973-4848. Well, one of the themes of this show, Dr. Carpentier, is to highlight the broad mosaic of the Right to Life movement. How did your journey evolve in this regard?
Well, as I was in training at St. Louis University School of Medicine, I really, wanted to put all of the things that I was learning in medical fields to apply it to women who are struggling with their problems with their fertility, such as infertility, yes, but also PMS and ovarian cysts, abnormal bleeding. We just see so much of this, and the natural response is, here's the birth control pill. It takes the doctor 15 seconds to write the prescription. Everybody knows how to take it once a day. Off you go. But that's treating maybe some of the symptoms, but not treating the underlying disorder. And this specialty comes about called NaPro Technology, which stands for Natural Procreative Technologies, using all of our medical skills that we have in family practice and obstetrics and gynecology, and applying it to these medical conditions that these women are beset with. We're trying to get to the bottom of why they're having trouble and fix that so that their body works naturally, so they can conceive naturally, one embryo at a time.
I see. Now, after your name, I noticed, of course, the acronym MD for medical doctor, but what is the acronym CFCMC? What is that all about?
That's Certified Fertility Care Medical Consultant. That means I'm a medical consultant, a physician trained in the United States, and certified by the American Academy of Fertility Care Professionals. And this is an academy that's started here in the United States but now has international renown. And in fact, I've received one of their prestigious awards. I'm one of 6 people in the world certified as an outstanding medical consultant in fertility care services. So the foundation of what we do is that the woman is observing her ovarian function using the Creighton model of natural family planning. She's observing the ins and outs of her cycle, and she can tell exactly when she ovulates, but more than that, she can tell how well she's ovulating. Wow. And how well the ovary is working. With that experience, we can now direct our testing, whether it's ultrasounds or blood work, hone in on the exact causes of her problem.
I see. How well it's working? How do you mean? I mean, if it's working, how well it's working?
Well, you know, when people think about natural family planning, they're thinking, okay, well, let me identify the time that I'm fertile and I'll try to avoid intercourse on those days and therefore space my children. But to do that, you have to know how well your ovary is working, or when it's working, when it's fertile and when it's not fertile. And you can tell by simple observations the patient can make at home. She's trained by a certified teacher, and then if, with the teacher's help, they're recognizing that, yes, things aren't going well with my cycle, the teacher can refer her to a doctor like myself anywhere in our country or Europe or Canada.
Now, what are some of the more common problems of married couples being unable to conceive? Is it old age, or what are some of the problems typically?
Well, old age is...
Old age, middle age.
Yeah, it's with our delayed childbearing, with our fast-paced culture, people are delaying childbearing into their 30s, and unfortunately it's only at that time that they're recognizing that all through their life they've had various problems such as polycystic ovarian disease or endometriosis. These are things that can interfere with their fertility, and these issues are only coming to light in their 30s. After age 35, it's more difficult to help somebody to achieve a pregnancy. So, be it as it may, oftentimes we're seeing people in their 30s with these problems, and we need to work very quickly to help them to improve their fertility.
I see. And yet women have had children into their early 40s or mid-40s oftentimes.
Certainly, especially women of normal fertility, certainly you can be achieving pregnancies up until age 45, sometimes a little bit later. But if there are some conditions that are making your fertility less promising, then we really need to be on top of that as soon as possible.
And what about the man in this situation? What issues come up with him?
Well, obviously, impaired sperm counts and impaired sperm motility as well are issues. And I think there needs to be more work on what leads to those low sperm counts and low motility. We don't really have any good factors. We talked about varicocele in the past, and men would go through varicocele surgery, but now the doctors that are specialized in varicocele surgery are sort of wondering if they're really making much of a dent. And I've spoken to one of these doctors from Boston, and he said that the most important thing that we can do is help the woman's ovary and cervical mucus to be at its top condition, and the sperm will get where they need to go, even if they're low in number and low in motility.
I see. Very interesting. You had mentioned something about I didn't hear the word before you just mentioned it regarding the men's
motility?
No, not motility, but not sperm count, but there was something else you had mentioned there. A word.
Varicocele.
Varicocele. Yeah. What is that?
It's just like some people have varicose veins in their leg. There can be varicose veins around the testicle, which can raise the temperature around the testicle and potentially decrease sperm production.
I see. Okay. Very interesting. Now, your success rate, or your group's success rate in achieving pregnancy for couples is much greater than, say, I'll call it traditional in vitro fertilization methods. Why is this the case?
Well, our studies over the past 20 years have shown that we have a success rate of about 60 to 80% in researching delving into why the couple can't achieve a pregnancy, and trying to fix that problem. We're able to help 60 to 80% of the couples, depending on what the cause of their infertility is. And with IVF, you know, there's some research that goes on into the couple before they head into the IVF procedures. IVF, of course, stands for in vitro fertilization, which basically shorthand would be that we're sort of bypassing their fertility. We're harvesting the sperm, harvesting an egg, putting it in the petri dish, achieving so many embryos, working on techniques to try to decide which embryos might look the most healthy and reimplant those embryos. How many embryos, up to the couple and the doctor to work that out. What they do with the extra embryos is matters for debate. And so then we're putting those embryos back into the womb and hoping that they take. Our system is more delving into why can't the couple get pregnant, what are the underlying problems such as endometriosis, low progesterone levels, low cervical mucus, abnormalities of the womb, and figuring those out, fixing those problems, and then the couple with the natural active intercourse is able to achieve the pregnancy one embryo at a time, possibly twins if they're lucky or unlucky, depending on how you look at it, but one embryo at a time, and that respects the dignity of the human person, that person is conceived by the loving act, the generous gift of both husband and wife within the marital bonds.
I see. Now, in reading some of your literature, I noticed you said you have a disease-based approach. What, I guess, what is that? Or maybe you've mentioned this a little bit already, but
briefly, we've talked about that. But as opposed to bypassing the system with IVF, saying, okay, there's something wrong, let's just do it in the Petri dish, we really say that's immoral in our point of view. That's not respecting the dignity of the couple, respecting the dignity of the marriage commitments, and taking things outside of their bodies. We want to try to fix what's going wrong, identify, diagnose, and fix it.
I see. Well, now, you've brought a big book here. Maybe we could hold it up for our cameras. And I guess I mentioned, what is Nei Pro Technology, and that's the medical and surgical practice of Nei Pro Technology. So
that's right. This is a work that's been evolving over the past 25, 27 years. Dr. Thomas Hilgers at the Pope Paul VI Institute for the Study of Human Reproduction in Omaha, Nebraska. He, in response to Humane Vitae, a call by Pope Paul VI, back in 1968 to men of science to try to understand the workings of the human body so that we can fix these problems and not need to resort to things that weren't even available then, such as IVF. But the popes understood that this is what our world is heading to. And so they called for us in 1968 to work on understanding the natural rhythms of the body, how the ovary works, and so that can be available to couples throughout our world. And Dr. Hilgers is one of the very few people in the world that really took that call seriously, and he developed the Pope Paul VI Institute there in Omaha. It's affiliated with Creighton University School of Medicine.
Oh.
And they're available on the web at www.popepaul6.com. So if people wanted to investigate his institute. And this book is a summation of all that he's learned over the past 25 years. It's written mainly for doctors, but certainly patients and natural family planning teachers could make good use of it too.
I see. I know that in 1968, with various religious organizations saying first you could use contraceptives inside the family marriage, and then that it evolved to the pill, and then the people who wanted the pill changed when conception begins, not at fertilization, but sometime later. And then the Pope was supposed to, everyone thought, the academics here in America, and particularly the Catholic academics, thought that he was going to fall in line with the others, but he came out with Humane Vitae. You have a little pamphlet here. What is that all about, Humane
It's not a
Vitae?
big document, but it's a very powerful document. With the guidance of the Holy Spirit and the teachings of the Church, the traditions of excellence over the past 2,000 years, they came up with the document Humane Vitae, written by Pope Paul VI. Pope John Paul II was then a cardinal, and he worked extensively on this document as well. So it's not a big document. It's quite easy to read. It's written for lay people, and it talks about when we try to manipulate our fertility, that we're going to get into problems. He said the divorce rate is going to rise, single-parent families is going to rise, struggles within the family and abuse within the family unit, abuse of the spouse, but also abuse of the children, and beyond. And then once we took that step to manipulating our fertility, then so many other things are possible, such as surrogate parenthood and things like this. That if we change at that fork of the road from respecting our fertility, working with it, trying to help it to work to its best capability, versus manipulating it and bringing in other scientific techniques, then we're going to be heading into trouble. And we've seen that unfold. There's a book called Why Humane Vitae Was Right, written by Dr. Janet Smith, and she sort of unfolds that the very things that the Pope cautioned are taking place in our culture today, not only in the United States but in Europe as well.
Wow. Now, as far as Nei Pro Technology being successful from a conception point of view, what about a cost and the tangential problems like leftover frozen embryos who are, I presume they are human beings in the earlier stages of the life cycle?
Well, from a cost point of view, I don't work for any in vitro fertilization centers, so I can't speak for them, but certainly patients that come to me after failing IVF have told me that the workup that's done leading up to the IVF is very minor. Not much diagnostic information goes into it. I asked them, why did they say you couldn't achieve? And they say, well, yeah, I don't really know. They didn't really say. They didn't focus on that. They just said I have to go into IVF. And how expensive it is, tens of thousands of dollars, probably just over $10,000 per cycle, per menstrual cycle, plus the drugs that they're given, the things that are happening within their body, very, very high hormone levels, multiple ovulations at one time, needles put through the vagina into the ovary to harvest these eggs. Then you've got all these eggs, and you take the sperm from the man for masturbation usually, and put it in the petri dish and let things take place there. It's, the Catholic Church would say that's not respecting the marriage union, and it's entering another party, these scientists, these doctors, to the conception event.
I would think it's degrading also, from a personal standpoint.
The patients would tell me that it is, that it's also very hard to go through. And the drugs that they have to buy are very expensive, and that's beyond the cost of the procedures at the clinic. So, and there's also, what they tell me is there's a board that decides whether they're going to go ahead with this couple or not. They're guarding their statistics, I would think, very carefully. And if you're over age 35, the chances of you getting through their board is very low. I'm willing to take anybody. And oftentimes the people that we can't be successful with, but they said, at least you tried. You tried things that live up to my religious commitments, and we appreciate that. And now we're either moving on to adoption or moving on to taking care of my elderly parents and so on, or using our skills in other ways besides being parents.
So would you say then the cost of Nei Pro Technology approach is less than the
much less.
fertilization?
That's right. It's a completely medical approach, so it's covered by people's insurances. Infertility is mandated by the state of Massachusetts to be covered by any insurance companies in Massachusetts. So my services are covered. There's some blood work that's involved. Mainly it's office visits. I think the biggest challenge to my patients is traveling to Gardner. Getting out of Boston into Gardner beyond Route 128, beyond 495. Oh my goodness, forget it.
A lot of people in Boston think Worcester is next to the West Coast.
That's right.
And then what about the whole aspect of, you mentioned a little bit earlier that you are only using one embryo, whereas the other approach in vitro uses many embryos?
Well, this is a good word that you use, uses. That's, speaks of the commodification of life, treating life as a commodity. We don't do that. We just help the ovary to work well. And if the ovary is working well, it's producing one follicle, which has one egg, and therefore the potential for one embryo. And so we're helping it to work well. We're monitoring its function, making sure that the follicle is living up to its standards, that it's a mature follicle and therefore has a mature egg. And once we've achieved a pregnancy, we don't just say, oh, congratulations, go see the obstetrician. We're saying we need to support this. If your ovary wasn't working well to begin with, it might not make enough progesterone to support the pregnancy. IVF centers have fallen into that in the last 6 years of using progesterone to support the pregnancies, but we've been using it for 20 years. And so, every step of the way, Dr. Hilgers has been ahead of the game. Thanks to the teachings of the Church, his dedication to womanhood, he's really been very respectful of the fertility process and knowing what's involved in helping that pregnancy to sustain itself. So our miscarriage rate is much less than the IVF centers. Birth defect rate is much less. Complications of pregnancy and premature labor is much less in NaPro Technology than it is in IVF.
I see. I recently watched the hearings in July of 2006, and they were talking about the people that wanted embryonic stem cell research, and this is not really the topic for today, but they were talking about leftover embryos, which, you know, I thought was very demeaning. You know, they're just going to go into the trash, and I just said, gee, what have we come to as a society that, you know, these are, we're all embryos at one stage of our lives, and, you know, this is how we're treating them now, and I'm hoping that there are more snowflake babies out there. Now, I question regarding the chance of multiple order pregnancies. First of all, are twins multiple order pregnancies?
Well, usually twins are called twins, and triplets and above is multiple order.
I see. And do you get that in the case of Nei Pro Technology, or do you get that more often in the case of in vitro fertilization?
Oh, much more often in vitro fertilization. They're usually implanting anywhere from 3 to 6 embryos into the womb. So you have 6 pregnancies, and if you want to count the ones in the petri dish, those are your babies too. But you have, you know, 3 to 6 that you're implanting. Now, 3 or more is getting pretty dangerous to the woman's health and to the health of the other babies, so then they'll offer selective reduction. Let's say if there's 4 babies inside the womb that are developing well, they'll say, well, you know, we would recommend that we go in and we kill one of those babies, we destroy one of those babies and stop the growth. And you know, which one that's going to be is sort of up to the ultrasound technician and the doctor, and which one they inject and so on and so forth to destroy that baby. So again, that's the commodification of life. How can you destroy a baby when that was your ultimate goal, was to achieve that pregnancy? And if we're respecting life as a gift, a supreme gift of marriage, gift from God, with all the talents and innate abilities and interests that that person will have as a gift not only to their family and their parents, but also as a gift to the society at large, you know, destroying these gifts is a phenomenal destruction. And it's happening, you know, very, very frequently.
I know I've heard the word selective reduction, which is just a euphemism for abortion, basically. Now, how is the Catholics, for instance, have their morals compromised in IVF?
Well,
we sort of have touched upon it.
Right. We talk about the right to have a baby. Well, there's not really a right to have a baby. You have by marriage and the state recognizing marriage, you have the right to try to achieve a pregnancy, but you don't necessarily have the right to a baby. The baby has a right to be born of a loving union of its parents and to be respected as a person. That embryo has that right. So if we talk about rights, the rights belong to the embryo, not to the parents. But the parents should be dedicated to that embryo, to that person, to take good care of that.
I see. And is Nei Pro Technology consistent with the teachings of the Catholic Church?
Absolutely. Absolutely. Every step of the way, Nei Pro Technology is consistent with that, and we don't step beyond that. We welcome couples from any faith. I have Muslim couples, I have Jewish couples, and all Christian denominations, and they welcome that this meets the teachings of the church. They don't necessarily follow that faith, but it still applies to them, very much so.
And is Nei Pro Technology a modern medical science?
Absolutely, to the hilt. I was just at a conference in New Mexico 3 weeks ago, and we're right on the brink of things that were approved in June. Such as letrozole is the newest thing for, instead of Clomid, for helping the ovary to work to its fullest extent. The new medicine called letrozole is coming out. It's not approved yet. It still needs to be considered experimental, but I'm very confident that as time goes along, letrozole will be replacing Clomid for the most part.
I see. And what do the U.S. bishops say about Nei Pro Technology?
They're all excited. They're oftentimes donating from their own diocese to the Pope Paul VI Institute, and they're very supportive of our work.
Is that right? And the Pope, what does he say about Nei Pro?
The Pope, supposedly, Pope John Paul sent money to the Pope Paul VI Institute as the only private institution that he sent Peter's pence to. So he's all behind it.
Well, wonderful. Now, Dr. Carpentier, how can a couple contact you about the possibility of conceiving a child and having a successful pregnancy? How can they reach you?
Well, they can call my office. I don't have a website yet. I'm just basically making use of the NaPro Technology website, which is www.naprotechnology.com. And or they can call my office directly. My secretaries answer the phone. There's no phone tree, and we'll help them out.
What's that phone number?
978-632-6880. It's out in Gardner, Mass.
Well, thank you very much. Well, in closing, we hope you learned a lot today about how loving couples can increase their chances of getting pregnant without compromising their moral and ethical values. If you'd like to get involved with MCFL in your community, you can start by contacting MCFL here in Boston at their headquarters, 617-242-4199, or visit our website, masscitizensforlife.org. Finally, we hope you'll inform others about our show, Life Matters. We're confident that if people know the truth, and they will ultimately change their hearts and minds to pure love and kindness for the unborn, the sick and the infirm, the elderly, and all humanity. Thanks for watching. I'm Brendan O'Connell, your friend for life.